Managing diabetes when sick is another important topic to consider. There are several things we want to keep in mind for good management of diabetes when battling a cold, flu, or other type of illness. So what happens during illness? When we're sick and fighting off a virus or a cold or something else, our body is using hormones to help us fight the illness, and this is naturally a good thing. However, for people who have type 2 diabetes, this causes your blood sugar to rise a little bit higher than you might normally see it. And this may cause you to need more insulin or more medication than normal during the time of illness. Because of this, it's very important to have a plan, because you never want to just decide to increase your medication dosage without having information from your doctor on how to do it and how much to take. So, talk to your doctor about what to do when you're sick. You want to plan ahead for sick days. This helps prevent a minor illness from becoming a major problem. Your doctor will help you come up with what we call a sick day plan. This plan will include how often to check your blood sugar, how and when to check for urine ketones, what medications to take, how to eat, and when to call a healthcare team. We will look at the components of a sick day plan, but remember that this is not a substitute for your own individualized sick day plan from your doctor. Some supplies that are a good idea to have on hand before you're ill are clear liquids without caffeine, sugar-free cough drops. Sugary cough drops can work against you when you're fighting a higher blood sugar, so having a sugar-free cough drop available is more friendly for people with diabetes. You want to pay attention to syrup-based medications that may have sugar, sodium, and alcohol in them. Ask your pharmacist to point you towards sugar-free, sodium-free, and alcohol-free medicines. So what to do when you're sick? It's a good idea to keep track of what's going on. Especially if you're not feeling well, you may not remember the last time you took a dose of your medication or what your last blood sugar reading was. So keep a record of your blood sugar measurements, episodes of vomiting, diarrhea, when you took your medication and what you took, and then any foods or beverages that you consumed. If you're unable to eat, drink 1/3 of a cup or 1/2 of a cup of juice or soda. Try your best to eat at regular meal times if possible to get consistent carbohydrates. As a general rule of thumb, test your blood sugar often, about every 1 to 4 hours, even if you don't typically monitor your blood sugar at home. Take insulin medications as you usually do, but do not take metformin if you're vomiting. Some other things to consider when you're sick: if you take insulin, extra insulin might be needed, since your blood sugar tends to run a little bit higher during illness. If your blood sugar is high, you can eat slightly smaller meals. If you're having difficulty eating, you want to eat or drink 15 grams of carbohydrates every hour, or 45 grams of carbohydrates every 3 to 4 hours. And just a note, 45 grams of carbohydrates is about 3 carb choices. Ketones may be present in the urine during times of illness. Ketones are a chemical byproduct that the body creates when it breaks down fat to use for energy. It happens when the body can't get energy from sugar in the cells. The body can't use carbohydrates in this case for energy, so it tries to break down fat instead. Now, some of you may be thinking that that would be great if your body broke down some fat. However, this is not good for your body. The body does this when it doesn't have enough insulin to use for glucose, the body's normal source of energy. When ketones build up in the blood, they make it more acidic, which is very dangerous. They're a warning sign that your diabetes is out of control and that you're getting sick. You can detect ketones with a simple urine test using a test strip, similar to a blood sugar testing strip. Ask your healthcare provider when and how you should test for ketones. Many experts advise to check your urine for ketones when your blood sugar is more than 240 milligrams per deciliter. Diabetic ketoacidosis is a serious condition that may happen to anyone with diabetes, though it's rare in those with type 2 diabetes. Treatment for this usually occurs in a hospital, but you can help prevent it by learning the warning signs and checking your urine and blood sugar regularly, especially when you're ill. Other times to call your healthcare team are shown here. If you have ketones present in your urine, or if you're showing symptoms signaling ketoacidosis or dehydration, like chest pain, trouble breathing, fruity breath, or cracked and dry lips and tongue, Or if you're not certain what to do to take care of yourself, it's never a bad idea to call your healthcare team.